If you could change one thing in the healthcare system today, what would it be?
Well, the one thing that I would like to see change, and what we're working on here at Evergreen Health, is increasing excellent access for our patients to healthcare. I think patients now are waiting longer than they need to see a primary care doctor, to see a specialist, to receive the care that we know can impact their health, their life, to invest back in on methods and ways, both through human capital, through staff and physicians and nurses that can increase that access for our patients, but also in physical capital, investing in procedural space that we can increase our operating room capabilities so that patients can receive timely, effective care that will ultimately benefit their long-term outcome.
Hi everyone, I'm Prasad Anguluri, your Bothell City Council Member and entrepreneur. Today I have a pleasure speaking with Dr. Ettore Palazzo, Evergreen CEO, and he has been serving our communities for the last 2 decades. And I would like to introduce to all our audience and understand what the impact he has been making for our communities. Dr. Ettore Palazzo, thank you for joining us, and please introduce. I may not do a great job. I want to make sure that our listeners know what you have been doing. Thank you, sir. Go ahead.
Absolutely, Prasad. Thank you for the opportunity to meet today and to talk about Evergreen Health. I currently serve as the Chief Executive Officer for Evergreen Health. We're also known as King County Public Hospital District Number 2. So as a public hospital, I also serve as the superintendent for the hospital district.
Great.
And while I've been in this role for about 2.5 years, I'm not new to the organization. I'm on my 23rd year here.
Wow.
Started as an internal medicine physician after training at the University of Washington, and have had the honor of serving in a number of leadership roles. Before my current one, I was the Chief Medical and Quality Officer for about 4.5 years, and now the CEO.
And you're an MD, and did you practice as a doctor as well?
I did, yes. In fact, most of my career has been as a frontline clinical physician, certainly more than I've ever been an administrator. Started in internal medicine was my training at the University of Washington, worked at Harborview Medical Center as an emergency room physician for a period of time, and then came to Evergreen Health about 23 years ago to work as an internal medicine hospitalist, which was essentially a physician based in the hospital caring for patients' needs. And so continued to do that up until about 3.5 years ago.
So what inspired you to pursue medicine and leadership, and what ultimately led you become CEO of Evergreen Health?
It's fun to reflect back on one's career path, and although each of those steps along the way, physician, various leadership roles, and CEO are mutually exclusive in my professional pathway, they all have a common theme. And for me, it was all about really important mentors in my life. There's a lot of my colleagues that have intimate family members that were in medicine, maybe a parent, and had exposure that way. I didn't have that. I did have, however, a distant family member that was practicing medicine in Italy. It was a cousin of my father's. And one summer he invited me out when I was in high school to spend time with him. And I lived with him, saw patients, actually went into the operating room, saw patients in his clinic. And while that was fascinating to me, just the practice of medicine, what was most fascinating was the human connection that I got to see and his connection with his community. And it's no accident that now I serve at a community hospital. There's a lot of places to provide healthcare, and doing it for the community is something very special I learned back then.
Great. Yeah, it is most important. Healthcare is most important for all of us. Thank you for serving.
It's my pleasure.
As CEO of a major health system in our region, what does a typical day or a week look like for you, and where do you spend most of your time?
The fun part about this job is that nothing is typical. I do have friends and colleagues outside of healthcare that often talk about maybe a day that was a little boring. That is never the case in healthcare. It's certainly not the case here at Evergreen Health. And while it is a dynamic job and things change all the time, there are 4 main areas where I spend my time, and I'll list them. None of them are in order of importance or the amount of time I spend, because it changes depending on the day. But one of the major areas where I spend my time is with our Board of Commissioners. Evergreen Health is a public hospital district, and so we have elected commissioners, like elected council members.
How many years?
There's 7 total.
Just like council members.
Exactly. They serve various regions of our district with some at-large members, and they're incredibly dedicated to the organization. They live in the community. So our board, our governance structure,
is the community. So I do spend a fair amount of my time with them, making sure that we're in alignment with the mission of the organization, the strategy. We have board meetings, board educational committee meetings. So that's one area. A second area as the CEO is I get to support all the amazing executives that run the hospital, that support the divisions of the organization. And so I meet with them frequently. We have weekly meetings as a team. We have one-on-one meetings to make sure that they have the tools they need to support the organization. The third area, of course, is one of the most important, and that is spending time with our frontline staff and with our patients together and making sure that the care that we provide, that we talk about at the executive level, that we talk about the board, matches what's happening where the care is being provided. So any opportunity that I can have to go up to the floors, out to our clinics to meet the staff and the patients that are receiving the care is a very special part of my job. The final thing, the fourth one, is as a community hospital, we belong to the community. So I need to be in the community. And so any opportunity I get to go out to city council meetings, to our community-based organizations, Rotaries, Kiwanis clubs, to share what's going on at the hospital, but more importantly, to listen, to hear about what their care is so I can bring that feedback to continuously improve what we do.
How many doctors do you guys have?
Yeah, so we have on our total medical staff about 1,300 physicians.
Wow.
The employed group, it is amazing. It's grown a lot.
Okay.
The employed doctors are about 450 plus or minus physicians and advanced practitioners.
You served as a physician, a quality leader, and now CEO. How have those roles shaped the way you make decisions today?
Yeah, it's fun to look at how you make decisions as a frontline clinician when you're taking care of your patient and that shared decision-making process with your patient. And then when you broaden that to quality and safety for an organization, how you need to focus on that. And then of course, as the CEO, when you're looking very broadly at the entire system and strategy, all those look very different. But I'll tell you, there is a common theme to every single one of them. Certainly it is for me. And that is that every one of those decisions in those unique areas factor back to what I describe as my why. Why do I do what I do?
Okay.
And for us at EvergreenHealth, and even when I was a frontline clinician, it's about the mission. And we don't make any decision, whether it's for a patient, for a quality incentive program, or for the entire organization, without remembering why we're here. And our mission is pretty clear. We're here to enhance the health of the community through compassionate, safe, high quality, cost-effective healthcare. It's based on our core values of compassion, respect, excellence, collaboration, and accountability. So every decision, clinician, quality leader, CEO, has to answer back to that primary reason why we're here. And that's how I make decisions every single day.
Now, very interesting question, and I am really curious also. How do you see AI and technology transforming healthcare, both for hospitals like EvergreenHealth and for the patients?
It seems a day does not go by, maybe even a minute doesn't go by, where we're not talking about what technology and particularly artificial intelligence will bring to the practice of medicine and healthcare. It seems like historically healthcare has been maybe a decade behind technology in applying. That has changed, particularly when we think about AI. And if I could rewind just a little bit, some of my time in healthcare in leadership was supporting IT services here. And I think about what I'm most encouraged about with these technologies coming is the fact that some of the work that we did before, while really helpful in ensuring appropriate documentation and the ability to make sure our patients were getting to the right place, sometimes hindered the interaction between the patient and their clinician. One of the last things I ever wanted to have happen is when I'm interacting with my patient, I'm putting a computer between us and I'm keystroking in and I'm not doing the thing that I felt was most important.
Yeah. I mean, been here last 20 years, more than 22 years. Whenever I go to the doctor, to make sure that they document everything that they spoke. Yeah.
Exactly. So one of the things that's most encouraging right now is we're using technology right here at EvergreenHealth, not unique to us, others are as well, where we're moving that computer out from between us. And now we're talking about what's important to you as we do our work together, as I'm examining you. We're letting the AI
job
machine
while you are focusing on me as a patient and a doctor.
Exactly.
So,
Provided the patient is comfortable, we've let the ambient listening
generate and create the document that ultimately needs to be there to address what we talked about. But some of the things that normally would then require me to, again, enter in orders for a chest x-ray, for labs you might need after our conversation, those can all be teed up and we can still continue to interact. That makes our time more efficient, but that human connection that needs to come back to healthcare is what I'm most excited about with AI. Now, rest assured, I have other friends here in the C-suite, my CFO, our Chief Human Resources Officer. Many are seeing where additional efficiencies are going to be helpful when we're talking about the practice of operating a hospital and healthcare system. But for me personally, that human connection, I think, is going to be greatly enhanced as a result of this technology that AI has put.
What advice would you give to someone who wants to make a meaningful impact in healthcare or community service?
So I particularly like this question. It reminds me actually of when I was just starting in my career in medicine as a medical student and working with doctors that were nearing the end of their career and sharing with me that medicine has evolved in a way that was maybe more challenging, more difficult. And now 30 years later, as I look back on my career, I can also say that medicine has evolved. It's become more complicated. But whenever I get a chance to meet someone who's interested in healthcare that wants to consider a career in healthcare, I get excited because despite those challenges, there are few professions in the world that allows us to do what someone in healthcare gets to do. And that is positively impact someone else's life and to have a human connection. And so whether it relates to healthcare and someone's interest in supporting it or being part of it, or the same applies to community service. The benefits that we receive personally as a result of helping others, the benefits the recipients receive, it's a special thing. And I get excited whenever I meet someone who's interested in healthcare or certainly interested in community service, healthcare related or otherwise.
You have someone from my family itself, and my daughter is considering healthcare, but at the same time, she is 10th grade. So she has a question or a concern. Oh, it's going to take 12 years before I become a doctor. It's not only the concern from my daughter, I've been hearing from some of my friends' daughters or sons. What do you think you wanted to tell them before they start this long journey, entering into the college? How would you like to?
Yeah, I would say to your daughter or whoever's considering this, the investment is worth it. The time that it takes to become a physician is long. It is hard, but again, it is worth it for the end product of being able to work in a profession where we're helping others, that every single day is an opportunity to try to make someone's life better. And it's worth the many years it takes to enter into that profession.
Great. Thank you. I'll let my daughter know. I'm sure she will share it with her friends too.
Great.
Thank you. So if you could change one thing in the healthcare system today, what would it be?
There are many things on the list for healthcare that
three, maybe, I don't know, one that
I'm going to focus on. My 1, 2, and 3 are going to be the same.
Okay.
Knowing that but thinking more in the short term, because in the long term, I think there's no disagreement that the complexity of healthcare, how it's funded, how on both sides, the healthcare delivery and the healthcare recipient, there are many opportunities to make that better. But in the here and now, the one thing that I would like to see change, and what we're working on here at EvergreenHealth, is increasing excellent access for our patients to healthcare. I think patients now are waiting longer than they need to see a primary care doctor, to see a specialist, to receive the care that we know can impact their health, their life, and their longevity. So we're taking strides here at Evergreen through the support of the community, through the recent levy lid lift that we were grateful to receive from the community, to invest back in on methods and ways, both through human capital, through staff and physicians and nurses that can increase that access for our patients, but also in physical capital, investing in procedural space that we can increase our operating room capabilities so that patients can receive timely, effective care that will ultimately benefit their long-term outcome.
Very good. Very good. Excellent. As a CEO, how do you stay connected to patients and frontline staff and understand their day-to-day experiences?
This is so important for me, and particularly how I entered into healthcare, as we talked about. I started as a frontline clinician long before I ever made decisions at administrative level. And so remembering what it takes to do the hard work to take care of patients will be something that I will never forget. And so the most important way to not forget, but also to address your question, is to meet both our staff and our patients where they're at. I make sure that on my schedule every day, I have time carved out to go out and what we call round, to go upstairs, to meet with the staff. One of my favorite activities is to meet with our nurses as they're doing their work, the doctors, hear about how things are going, their concerns. And then when that's done, asking them, do they have a patient that would like to meet the CEO?
Why?
And
Nice.
it doesn't have to be a patient that's overly happy about their care. That's always wonderful. But when we get to meet a patient that we know there's opportunities, each of those touch points is a gift. And so I make sure there's time on my schedule every day to meet both our staff and our patients on the front lines where the work is happening.
Very good. So that you wanted to see where you can improve. Are there any inefficiencies?
Exactly.
If there are anything. Great, good, awesome. So, what healthcare changes do senior citizens in our region face?
Healthcare challenges for our senior citizens, unfortunately, are not just unique to them, but I think in some respects, because as we age, chronic illness and the challenges that come with natural aging require more touch points with healthcare. And as a result, that same issue we talked about before with access, I think is definitely at a level for our seniors that we need to understand better. So access to geriatric care, access to the procedures that they may need as they get older is something that is a challenge. I think also in our region, it is difficult to age in place. You have individuals that want to stay in their communities. And meanwhile, making sure that you have the resources to do that, what we can do on the healthcare side, but there's things outside of healthcare when it's about transportation and all that needs to be in place for our seniors to be where they need to be, both socially, but also medically is an important part of that. We're working hard in EvergreenHealth. It's not a new initiative. We have a dedicated geriatrics clinic that actually is partially funded by our levy. And that's an important investment that we continue. We also partner with the North Shore Senior Center to make sure that they have additional resources to care for our seniors.
Dr. Palazzo, it was amazing insights and meaningful, forward-looking conversation that we had. You touched upon it. I'm sure our listeners have learned quite a bit from this, and we hope to meet you again too. Thank you so much for giving this opportunity and sharing your thoughts and your journey. It was amazing. Best of luck and continue to make more impact for our residents. Thank you, sir.
Thank you, Prasad. It was an honor today.
Thank you.